Welcome to all the White Army members to this special session on orientation to internship. First of all, I would like to congratulate all the new doctors after recently concluded final year MBBS examinations. We have got many more bright, genius doctors to our club now. We are our families much more stronger. So once again, congratulations on behalf of all the doctors, senior doctors out there. And to start with, yeah, it's time to enjoy, I understand, and to relax and enjoy the time. Meanwhile, I thought before you start your internship, maybe a week later, it's as a senior, it's my duty to guide you properly. So I'm very old now. I'm not like very pertinent to the current time. But meanwhile, I have arranged some experts or achievers of your own from the recent times to guide you in this regard. How can you make the best use of your internship and excel in your like academics, like internship training, as well as the future, the way ahead of entrance exam preparation. So I have selected the most active members of White Army, who I have been seeing for last for 3-4 years now, and they have been actively taking part in all the discussions, their academics, they, like in an all-round manner. So first of all, I would like to invite our own core member of White Army, who have done a lot of contribution to White Army, Dr. Nandini, who finished her MBBS from BGSGIMS Bengaluru, and currently preparing for entrance examinations. Welcome to you, Dr. Nandini.
Thank you so much, sir. It's a pleasure to be back. But I also have to say that I think Kishan sir is understating how up to date he always is. He's never too much of a senior.
And she herself is a very great achiever and inspiration to most of us. And a second panelist and also achiever, also resource member today, a very active member of White Army, Dr. Anjali Pathak. She has presented so many. If you go through the videos of White Army, many presentations are by Dr. Anjali. So Dr. Anjali is with us today. Actually, this actual session is actually planned by Dr. Anjali herself. Okay, she wanted this session to happen. We have already done.
Yes, sir, because last time I was someone who got motivated.
But Anjali wanted another session. Session is dedicated for only actually. Anjali is also a very good, great achiever. She has secured some last year. I remember 85% in final year. Anjali, am I right?
No, sir.
Huh? I know more than 80% for sure. Okay.
No, sir. So 70. Okay. 70% it was.
Now, does that matter really? Your
No,
in internship anywhere, did that really matter? How much percentage you got, or anywhere anyone asked? Looking
No,
at you,
sir.
no. So Anjali is there to guide us today. She has completed the internship from one of the prestigious colleges, KRIMS Karwar. Welcome to you, Dr. Anjali.
Thank you so much, sir. You are actually the guiding power for all of us. I still remember when I finished my final MBBS, I just spontaneously joined the intensive session and you suddenly made me moderator. Like whatever points I learned from that, I am still implying it. Like, thank you so much for your guidance.
And I'm just a moderator here, okay, just to do the technical part here. But as a real highlights of the day, this session, we have 3 aspiring interns with us, okay, to represent all the lot of interns in our country or even abroad. I have got 3 most active members of the White Army as representatives who have recently concluded their exam and done really well. They have done really well. One of them is one of my favorite students of all time, Dr. Aditya Choubey from Bangalore Medical College. He has been the most active member of throughout, and he almost attended each and every session of White Army. Have been actively answering most of the sessions and liked by all the mentors of White Army. Welcome to you, Dr. Aditya. And he has attended almost all the quizzes and won so many quizzes. I can tell 1 hour about him anyway. Just be contented with that much introduction, Dr. Aditya. Welcome to you.
Thank you, sir. Thank you for having me here. I think it's like the perfect time for our orientation before we get started. So thank you for this session.
And at another most talented girl I have seen, and in fact, she is a national champion in chess. One of my own students, and such a brilliant and very studious girl. She recently completed her final year with woofing 80% in final year. Dr. Swathi Bhat from Mangalore, AJ Medical College, Mangalore. Welcome to you, Dr. Swathi.
Thank you so much,
How
sir.
it sounds when I call you Dr. Swathi?
Yeah, it is different.
How does it sound to you?
It's very, it's like a dream come true. Like 4 years we have studied and finally we have got this title
Coveted
of
degree.
doctor.
When you get that coveted degree of doctor, it really sounds
not-
good, and
It was not
you feel
just an
so
examination. Yeah, we got a title next to our name. So it was, it's very exciting about it. And yes, sir, thank you, sir, for having me here and also for conducting this session so that people like us, like a lot of interns get benefited from this session. And also thank you to the panelists for Anjali ma'am and Nandini ma'am for taking time and doing
our
this
duty,
session.
Swathi. Always our duty. Okay.
Yes,
What are the
sir, yes.
problems we faced during our internship or whatever? We don't want our juniors to face the same. You may
Yes.
face some new problems, we don't know. But whatever we face, practical obstacles, our juniors should not. That's only our concern. Okay. And one more, I should say, he is one of the most active member of the White Army and very enthusiastic, very energetic. Dr. Hriday from Agartala Government Medical College. He is still in confused state because he has written the exam, still waiting for his results. But I'm very sure that he will come out with flying colors. He'll do the best in his examination as usual. Welcome to you, Dr. Hriday.
Thank you, Kishan sir, and thank you, White Army. Thank you, Kishan sir, and thank you, White Army. You are the best senior we got from AJMC, and you are guiding in all the steps towards our future. So I hope this session will be very interesting today, and will, as a new intern, will learn lots and lots of things from this session.
Dear friends, if you ask me, throughout my medical journey, which I always cherish, is my internship days. I always cherish those fond memories. I summarize in general the internship with 3 P's to make it simpler for you. First thing in internship is practice. Whatever you learned in 4.5 years, so much of theory, practical, everything, clinical postings, everything. Now it's a high time to put them into action. So that's first P. That is practice. Whatever the knowledge you have, try it out now on the patients, real patients. In earlier you have done it over like anatomy in the dead cadavers. Now it's time to experiment on real patients. Second thing is perform. Yes, now you are a doctor. Okay, doctor is not just a degree. It's a personality altogether. Doctor means it's a personality. So you can't change your personality just with a degree or today you got a degree, tomorrow you will suddenly change to become a doctor. No. So it's over a period of time, gradually you acquire that personality to become the best possible doctor. So this is your time, starting time to perform yourself as a doctor. Soon you will realize or understand it's not just prescribing pills or doing some surgeries there. The doctor means it's much beyond that. You have to manage not just the patients, but the entire scenario. Maybe patients, attenders, even the other hospital staff, nurses or technicians, everything. You are the captain, you are the leader of the entire team. So it's on you to how you manage well. So this is the time to highly perform as per the expectation of the society or your other colleagues, whatever. So third thing is your journey is not ended. It's just a beginning. You have to prepare the way ahead. What's the way ahead is PG, post graduation. For that you need to prepare. It's a high time. So third P is prepare for your entrance exam. So practice, perform, and prepare for the future. So I would stress on that, prepare, because if you put little more effort during this internship and prepare yourself for the entrance exam, you will save one big year which is the most frustrating era of any medico in the future. So that you will save. So I wanted to be like really stress on that beforehand, so that no intern repents later. Okay, this 1 year you will work hard in your whatever the postings you have. Meanwhile, you prepare well for your entrance exam, so that you get into any good desired branch of your choice in post graduation at the earliest. Okay, so with that introduction, we shall start. We shall start with our new doctors there. Okay, Hriday, very lovely faces, very bright faces. Hriday, Aditya, and Swathi. I want to hear from you. What's your idea about internship? Yes, you have attended the postings, you know something about like what's going on in the wards, hospital, etc. But still, when it comes about internship, what's your idea, whole idea? And do you have any particular concerns, or any apprehensions, or any you feel anxious or anything of that sort? I wanted to know, make it clear, this is not just Hriday's perspective or Aditya's ideas. They are representing the entire interns out there who are watching this video. So it's, don't take it personally, or don't just think that why Swathi is asking this kind of questions. That is just to make everyone's doubts clarified. She's asking that kind of questions here. So first, let me begin with Aditya.
Sir, first of all, I think my idea of internship, that it's a paradigm shift from learning to working. So all
Exactly.
this while we were just going towards seeing the case and discussing, we weren't doing anything to the patient. Now we get
Actively,
that
yeah.
opportunity to treat that person and make a change. But yeah, I am still I don't know everything about it, and I thought let me ask a few things. So one thing I wanted to know was like I think all interns will go through rounds, like morning and evening
Correct.
rounds. And I wanted to know like what are we supposed to do in rounds as interns, and how do we deal with like if any mistakes are committed, how do we handle those things?
Correct. Okay, we will surely deal with that. Okay, if you have any other questions, you can ask at the end. If you don't answer any of your queries, you can directly separately ask at the end. Is that okay, Dr. Aditya?
Yes, sir.
Okay. Okay. Hriday, do you have any concerns or any exaggerated ideas about internship?
Yes, sir. For intern like us, newly coming intern like us, in our whole MBBS career, internship is a period for me, like we will be called as a doctor. And it is a respect for us as a student for overcoming this whole syllabus of MBBS for 4.5 years. And will be a doctor, and people, we should respect, and we should be respect like that. So my concern is, and most of the time I am hearing that people are going to the internship with a happy mood and they are studying, but after 10 and 15 days they are telling that it is very toxic and it's a very hard time for an MBBS student. And so I want to know that is it real, because I don't know the actual scenario. So I want to know.
Correct. Very good. No. This way, not just yours. 99% of the students or new interns will have this kind of fear. Not just you, Hriday. I'm very sure, including Aditya and Swathi here, 99% of the students will have the same kind of fear. And I would like to say, answer even only one line. Okay, that Hriday, you are not the first one to face this internship, right? So
Yes.
many thousands have done this, and thousands going to do the same thing. If they have done means you can also do.
Yes.
Okay, that's it. As simple as that. Okay, so we'll discuss about in
Actually,
detail.
I'd like to take that question.
No. Yeah, you will definitely will go to. Just we'll ask their perspective first. Okay, Swathi.
Yes, so like Aditya told, I'm also very excited because we are going from a transition from being a student to actually being a doctor. How does it work during the rounds and all? And I would also want to learn from the experienced doctors, like looking at them, how do they manage the case and what is their approach to a case. Then also how to manage stress. That is the most like stress and time management during internship, so that we can study for the exams like NEET, PG. Yes, sir. So I'm looking forward for the experience.
Correct. One thing, Swathi, there,
Yes.
we should understand, or we should realize that, yes, internship means it's a training phase. You're not a full-fledged doctors here.
Yes.
You are trainees under some senior doctors.
Yes,
Okay,
sir.
so you trainees means you're still students only with a degree, provisional degree you are having. Okay, you're
Yes.
licensed to this thing. What is that? Get trained.
Yes,
So
sir.
you are not responsible for anything. Even if you do some mistakes or anything, you're not responsible for it. Even your senior or your boss is
That is
responsible for yes, what are the mistakes you do, whatever the wrongdoings, you are not at all responsible. That doesn't mean that you should do all the mistakes. No, never.
Yeah.
Okay, you have that liberty to to be free and utter will and wish with the boss permission or as per the orders of your seniors, you can do. Okay,
Yes.
that's what training is all about. And
Yes.
with that, we shall start from our experts or those who already achieved and done their internship excellently. I have got the students from different backgrounds also. That also you should note here. Okay, we have one from a government setup with the internship who was done in a government hospital, how it would be. Another from a very coveted hospital, very like premier hospital in Bangalore. Okay, Nandini has done. And even the students, they're also from different backgrounds. One is from the busiest hospital. You are going to work in Victoria Hospital, the Aditya. Okay, and Agartala Government Medical College, I myself have worked there. I know how the hectic schedule is. And Swathi, I'm here working here with Swathi. I know how the internship in AJ Hospital. So different background. So all our audience can relate to this, whatever the experiences they're sharing, and you can correlate yourself to be there and imagine, and you can relate better that way. So first, I would like to hear from Anjali. How was your internship and how you made the best use of it? Anjali.
So when I started with the internship, I was clueless. What to do, how to do, what not to do, I was clueless. But slowly I learned. Coming to how to make the best use of internship, first I would like to say you should be open to learning. You should be ready to learn from anybody, be it group D, be it
Correct.
nurses, be it professors. Honestly, I have learned my first suturing from sister. I have learned the first dressing from group D. So how I made best user, like I was open every day. I had one target, something new I have to learn every day. Be it
Correct.
anything, be it personal level or professional level, I have to learn something new. So daily I used to be exploring. Second thing is that the one of the most important or vital thing in a doctor's life is communication skills, which
Perfect.
till final year I was not exposed to anything. What I used to do, I used to go to the wards, take cases and come back. But in internship, I was actually exposed to how to communicate in different scenarios. I think being a doctor, communication is like one of the most important part. And that I learned in internship. And the third thing is like, just a second, sir. Just a second. And third thing was learning skills. So it was like many of my friends I used to see, they used to just do basic writing work and they just used to go off. But I was someone who used to irritate my professors, my PGs. Sir, I want to do this. One time they'll tell no. That, sir, I want to do this. I think this skill, when initially I was going to enter internship, Kishan sir said me one thing. You should be behind your professor. You should be behind your PGs if you want to learn something. Or else if you will feel like it will come in platter to you and you just have to take it, that is never going to happen, especially in government setting.
Correct.
So these are all things I personally learned in internship, especially the communication part I would like to stress on. In internship, if you're doing, see, skills are important for us. But the communication part, if you don't have that skill, goes in vain, what I feel.
Correct. Excellent, Anjali. So even I will add to that. Even I learned my first delivery, doing delivery from a student nurse, for that matter. I learned my suturing from a nurse again. And I'm the one who gives respect to all the people, including the security guard who is standing in front of the. I salute him and go enter the hospital, because I know without him I can't work safely inside the hospital. Without the group D worker, if she's not there for 2 days, I can't even put my legs in the ward. So we have to give this is the first learning there as interns. We have to learn from everyone. We have to mutually respect each other. It's not that we are doctors, we have some extra, some horns here. No, we are also like any other human beings. So we have to respect each other mutually. All the staff in hospital, you have, first thing, okay, be humble, polite, and be ready to open-minded to learn from anyone. Okay, it's not just only doctors are going to teach you. Okay, many a times technician will teach you the better than anyone. So you should be like, how I made my internship easier is I had contacts with everyone. Wherever I go, I'll make friends there.
I have 750 contacts now.
Yes, you make contacts. What happens is your work becomes easy. You need not have to run here and there okay, from the lab to the lab, everywhere. You need not have to run. Everyone happens through your phone number. If you have contacts or if you have goodwill in all the places, if you have made good friends, you can ask over a call, Vaya, report ready hai kya? Ready, aa jao, abhi aa jao. Then you will go there. And otherwise, 4-5 times you have to run to the lab and for one simple report. So first thing is, like Anjali rightly mentioned, communication skills. You, how much or introvert you are, how much you are silent, or whatever kind of personality you have. Here, all this doesn't like really count. You should be outspoken. You should be shown as if you are very confident and speak with everyone. You should only start the conversation. I am doctor. Let everyone come and talk to me. Or no such demands. You, bhaiya, kaise ho? Khana khaya kya? You start the conversation and make everyone friends around, and be humble with everyone. Then automatically your whatever the requirement is there, it will be fulfilled. They will only help you. They'll have a very good opinion about you, and they will also spread with the senior colleagues and all. Yes, that student is very good. He's working really hard. So even the professor will have a good impression about you. So it's not in there is a dictum. Our hospital wards also have got eyes and ears. Yes, my dear friends, remember this. It's not that someone is asking about the rounds and all. It's not that whatever you work in front of your professor that really counts. They'll get impressed. No. Even after they leave, whatever you do there, no. Even your group D workers, sisters, everyone will inform to your professors. Then they'll get they'll come get all kind of feedbacks sitting in their office rooms or in the whatever wherever. So try to be very honest. Work like you want to. You are willingly working, not for the sake of working. Like someone mentioned, just clerical work. Oh, what is this? No, work enthusiastically, work willingly. Okay, then everyone will be impressed around you. They'll have a very good opinion about you. All your concerns, like what Anjali was telling, I was behind my professors for the procedures and the other this thing. Everything will be automatically fulfilled. So first thing that, see, tell me one thing, Hriday, why I should give you any chance to do? Why I should give simple suturing to do in a patient?
Sir, if you see, I am confident about
just because you are my student or just because you are my trainee, I need not have to give you any chance. Aditya, you understood? Just because you are a topper, I need not have to give you a very vital bleeding patient for suturing to you. I will give you only when I trust you that you can do the justice here. Yes, if I give you this chance, you will do justice. You'll do better than me. If I get this kind of trust in you, only then I'll give it to you. Just because you are a BMCRI or you are topper or you are scored 80%, I'll not give you a chance. So it's on you to gain that trust of the consultant or the nurse or anyone to get the chances. You can't just crib, I am not getting any chances. I'm just doing clerical works. I'm just meant here for writing something. No. What I told Anjali is the same. If you want chances, first prove that you are trustworthy, you are efficient. First show to them. Then automatically you'll get the chances. Then of course you should ask, sir, PGs, when there is a trauma cases come, you should ask them, sir, can I do the suturing, sir? Anyway, I have learned suturing from Kishan sir in my final year only. So can I try it out? Please, sir, please, please, please. Then nobody, no senior can no to you. If you are just let them give chance to me. I'm a no, nobody is going to give you chances. So that's what Anjali was telling. I was behind professors. Okay, it's not that she was literally behind the professors. No, She was always showing that yes, she's hardworking, she's reliable, she's trustworthy. So you can give me some chances also. That's what she meant by behind the professor. So you should openly ask. You'll get only two kind of answers if you ask. What is that? Yes or no. Get it's a it's a profit. If you don't get nothing, you're going to lose anyway. Correct. So you should ask openly, sir. I want to put insert rails. You please, can I put this catheter, please? I have seen video and I have done it on a dummy. Now I want to do it really. You ask your PGs, then you will get all kinds of procedural skills, whatever you want. Okay, that's what Anjali meant. And yes, she gave utmost importance communication skills. There's no alternative but for it in your internship. You have to be conversing with your patients, attenders. You should be consoling them, comforting them, everything. Okay, they will ask you to take the consents, informed consents for all the OTs and all. So you should be in a position to able to understand, make them understand, convince them. All those big surgeries doing surgery, but patient party saying that you are only doing surgery, the way you are taking the consent and all. So you should look confident. So your communication skills should be very good. Okay. With that, we'll move on to Dr.
And
Nandini.
one more thing I wanted to add on, sir. Yes. I think your biggest teachers are your patients. So, correct. So first, if you are a really good listener, half of the things you can diagnose very easily. If you just listen to the patient, and the patient satisfaction also will be very high. So this you should inculcate. Rest up to Nandini.
Correct. Don't treat them as any just the people lying on the beds there. They are your real teachers. You are going to learn the entire year from them only, not from any teachers here. Patients are your real teachers. So give them utmost respect. Learn from them as much as possible. When any patients are in the ward, go to them, talk to them, try to elicit all the findings, test whatever you want to do on them. Okay, and don't try to bluff. Okay, as if you're already, because your small test may make a lot of difference. So in rounds, someone is asking about the rounds. So rounds is going to be very interesting. In the internship, rounds is going to be very interesting because yes, in the front there will be head of the unit, professors, assistant professors, SRs, then PG, third year PG, second year PG, first year PG. At the end, there will be interns. Behind them will be nurses. Okay, it's a big line. But interns will be the main focus there, because any questions first, the professors will ask you the interns. Any rounds first, the question starts with the interns. If they can't answer, then it will go to the first year PG, then second year PG, third year PG, then sometimes to the SRs also. So initially, many units will have grand rounds in the morning. Entire all the patients will be seen in detail. A PG will be presenting the case. Okay, and meanwhile, you should be ready with your findings as an intern. Sometimes you will also be asked what are his vitals. Then you can't look up and down. Your main work is duties to check the vitals of the patients, and any updates in the treatments or reports you should be ready with. So if you always carry a notebook with you in your apron pocket, always carry a notebook. Okay, so that any important which you can't remember the what is the numericals, you can write it down, jot it down. You can read it out to the professors. So when you answer, they will give when you tell those report and all very honestly, that will give a very good impression to the professors, teachers, and they will praise you in front of the PGC. The intern has done so well, you can't do then like that. So rounds will be very interesting, and you need not have to worry about anything in the rounds. All the stake on the PGs mainly. You have to do your duty. That's checking the vitals of the patients and doing some minor dressings or something, and putting the daily notes, daily progress of the patient. That you need not do. You should come early in the morning. You should do this writing work or checking work in the morning, and be prepared for the rounds. If there are any interesting cases in the ward, keep reading about that. Okay, everything is in your fingertips now. Keep reading about that particular case, because professor is going to discuss that particular case, and all the questions will first directed to you. So you can prepare yourself for the rounds that way. Okay, and you will also have some separate rounds with your postgraduates as well. So that time they will teach you. See, this is how, these are the findings, everything. So if you are open-minded, if you are very good with your PGs, so you will learn a lot from them also. So let me move on to the Dr. Nandini. How was your internship experience? How did you make the best use of utilization of the internship, Nandini?
So I don't know about best use, but my experience was that before I started internship, I was determined to like make sure I was planned, or there's supposed to be some kind of planning when I go into this. So I'd watched all of the White Army videos of like previous seniors' experience. So I came up with this method where before going to any posting, I would make like a list of my expectations of the posting. So one of my first hospital postings was pediatrics, and I'm partial to pediatrics. That's where my interest is. So I've made down a list like, okay, before the posting gets over, I should have drawn blood samples from like an infant, a neonate, and like an uncontrollable child. And I should have seen these kind of cases. I should have been able to answer or like whatever doubts I had about certain things, like I had to clear it with the teacher, like whatever my expectations of the postings were. When I went to emergency, I knew that, I had to draw blood, I have to take ABG samples, I had to perform like a gastric
things to
lavage.
be done in that particular postings, you knew them in beforehand, correct?
Yeah, and whatever little bit of preparation that I could do, I would do it. Like before I went to medicine posting, like I'd make sure that I knew ABG and I knew how to read the basics of ECG. So these were the kind of things that I did. And then throughout the years, even no matter how much you've studied, you kind of forget the correlation between the theory and the clinicals. So for example, like during fourth year, you would have studied that, if you're putting this patient on heparin, I better manage PTT. But then the thing is, while you're doing all this theory, you forget to correlate it clinically. So I would go back, like before entering like my favorite course, like medicine or pediatrics, I would go through a lot of the investigation and be like, see where this investigation is used, what is the expectation, or like what is the inference, and like how I can, assimilate this into my work. Because the one thing that Kishan sir had stressed with me is that you're not a clerk, you're a doctor. So even if you're going to collect a single investigation, you better at least see what you're collecting. Because if you just go collect it and give it to your doctor, then you have not been a doctor in that scenario. You were just a clerk. So I tried to like go through the steps, like the basics of what I was doing. I tried to find like little joys of being a doctor in like small things also. Like if there was a discharge summary, like I think most of the times you'll just rush through all this cut work, but sometimes there are like these small little joys where you find some mistake or you find some small intricacy and you click, like there's a diagnosis for a patient, but when you're going through this investigation, if you can diagnose the patient by just looking at those investigations, it is a different kind of high. Like at that moment you'll be like, oh, okay, I can do this. And then there's a different confidence that you find in yourself. And I think that internship is where that starts, because at this stage there's a kind of innocence that associated with our career right now, because we're new to everything and we find fascination everywhere. So this is that 1 year to make the best use of it, to like make use of all of these small things that you might not notice in your future. So that was my plan.
What Nandini meant was preparedness. See, you should be well prepared. Now, already in the beginning of the internship, you will be given the roster, right? First, you'll be having a community medicine posting, then you'll be having a pediatrics posting. You'll be given the roster. So, 1 day or 2 you take to prepare yourself for that postings. Okay, you have during postings, clinical postings, you already visited the particular branch, the wards, everything. So you know what it's going to be. So what are the prerequisites as an intern in pediatric postings? Know from your colleagues or those who already finished or from PGs beforehand, and know the basics of that at least. See, when you're in medicine, you should know the basic interpretation of the ABG or ECG. What I told Nandini was the same. See, some people are working in a very a very busy environment. Especially you will end up doing just doing the ECGs, and you'll not even have time to even interpret or go through the ECGs what you have done. Just that's just a clerical job. Doing an ECG is not a big thing, but for you, what is important is trying to interpret that. Don't just do clerical job. Just take a ECG and give it to your PGs, sir. No, before handing over the ECG paper, just go through this and try to put your knowledge there and try to interpret yourself. Then go tell your PG, sir, I feel that this is some ST elevation is there. Am I right, sir? Or I think there is kind of some fibrillation is going on here. So am I right, sir? So put your opinion there. You may be right or wrong. Then PG will, yes, you are right. Or no, that's not ST elevation. This is this thing. So they may try to correct you. That's how learning goes. Or if you just keep, like Nandini mentioned, you go to the lab and collect all the reports and just give it here. You are not required there. Any patients attenders also can do that. You are a doctor, man. You should do doctor's job. Okay, that means you should, a report is okay. You being a junior most doctor, it's your duty to bring the, like, do all this clerical job as well. But then not just doing that. Try to put your own brain also there. Try to interpret yourself. Yes, hemoglobin is low, platelets also low. This is low. What next I can do? I'm think this is this thing, this thing, cytopenia is there. So what next? If I'm the consultant here, if I'm managing this patient, what I'd be doing next? So try to make your own decision. Then when the consultant really does some decision, you can correlate. Yes, I thought about this peripheral smear. Now the consultant also telling the peripheral smear, yes, I'm in the right way. Okay, you get a lot of confidence there. That's how. Okay, so please don't just do clerical work, but prepare yourself. Okay, to at least the basics of that. Especially when you are enter the surgery postings, you should know the basic requirement there is to do the suturing. You can't go there to the surgery department, start learning the suturing over a real patient. No, that's not accepted. Okay, you should have done it beforehand in your some suturing kits or somewhere, over the banana or something. Then when you're really, because their patient will be under anesthesia. Okay, you can't. Nobody can teach you from the beginning there. If you have some idea about that, then you can try out there. Okay, time is not a constraint, but really learning from the beginning over a real patient is difficult. Okay, so have a basic preparedness before entering into any postings, and then that's how you can make the best use of it. That's what Nandini meant. Excellent started we wanted. And second thing, Anjali, I wanted to ask
and
is,
sir, I wanted to add one more thing. We have
yes,
an interns logbook. I think that has like every posting, what and all things you should learn, point wise will be given. So if
okay,
you, I think it will be on MCI website also, and if I have, I'll forward it. You can get to know
sure.
exactly what you have, you must know from that posting. So it will be easier for you guys. Yes, sir.
Okay. So, Anjali, I want to ask you, you already mentioned about some of the qualities which any intern should possess, or as a doctor we should have. That's one is communication skills, preparedness, Nandini mentioned. Now, what do you think? What are the qualities required as an intern to become the best doctor in future?
So first, the ability to take quick decisions, I feel, because quick and sound decisions at the same time.
Okay.
Because, for example, if you're an intern, you're the first person seeing the patient, be it ICU or
Correct.
intern. If you don't have the quality of taking quick decisions and immediately analyzing the patient, whether the patient is going on shock or
Correct.
something, you will not be able to inform your seniors, and it will lead to loss of one life. So first thing,
Correct.
like ability to take quick decisions and sound decisions. That's very
Mhm.
important. And second thing is, I feel stress management. It's very
Okay.
important because in internship you'll have at a stretch 56 hours, 48 hours duty, especially in postings like medicine and pediatrics and government setup. At that time, if you don't know how to manage your stress, how to figure out things, then things won't have come to in place.
Happen. Correct. Mhm.
So these are, and the third thing which I feel is like that only being open-minded to learn anything.
Correct. Correct. Yeah. Nandini, you want to add anything to that?
Yeah,
Any particular
so
qualities or virtues you should possess to be a best intern or future doctor?
in my experience, something that was hard earned for me was discipline, because I feel like as a doctor, you've spent all your life being just a student and you really haven't had this kind of accountability. And then all of a sudden, you're put into this medical field in the hospital setup where the stakes are very high. So, one of the things that I would see around me that I really do not agree with is like being jovial or like be talking about something personal in front of a patient. Like there were many instances where like we'd be in the emergency room and the faculty members would just be joking in front of the patient. But like, you should realize that that is not the setting, and you're actually giving off an image about not just yourself, because you're representing you, your
The
department,
community, yeah.
the doctors, because it also matters of how the patient perceives you. So I think this field that we're in, it demands discipline, and that was something that I learned through the hard way, because I think I've also made a few mistakes, because it's very hard to be in the same way throughout the year. It's very hard to keep up that, like, to be determined and keep up that discipline the entire time, but I think it's something that we must learn to inculcate and practice.
Very, very well said. We should empathize. We should empathize to our patients. Okay, we should be like disciplined and bit decorum also we should maintain, because our job is not like other usual jobs. Okay, the patient have a lot of expectations from you. They don't know that you are an intern or you are just a trainee doctor. They think that you are the big doctor. So they expect all kind of solutions from you. They all kind of consolations from you. Everything. So be in a position, act very like in a very serious manner, or if you be diplomatic also with them. Okay, so don't be like just joking around or with your friends. Don't, that's not a place. Hospital is not the place for any fun or enjoy keeping the patients happy. That should be your enjoyment. That should be your motto, not having fun with your friends or some outside. Instead, your in next 1 year, your only fun is to keep your patients happy, their family members happy. Okay, put your heart and soul to keep everyone around you happy. Okay, then you will also be automatically happy. Help others to help, Nandini, ourselves. Okay, that's the motto of White Army as well. So next question to Anjali is, yes, are new doctors having some kind of apprehensions? Okay, in the beginning now, you also had the same, even I had the same, what I will do, how I will do, what if I make some mistakes, and all those many. So how to overcome them? How I could how I can overcome them?
So first thing, we should think like, okay, we are doctors, but we are also humans, and humans do make mistakes.
Correct.
So you should, the habit should be like, you should learn from your mistakes. At the same time, you should not take any decision by yourself, at least at this part of time, because you just have finished your MBBS. Like many people I have seen, like, okay, I'm a doctor, I'm a boss now, I can take any decisions by myself. It doesn't work like that. You should consult with your seniors once. Like, am I doing it right? At least in initial 2-3 months. First thing I would say that. And second thing is like, yeah, you will have a lot of apprehension, like how to go about things, what to go about things. But every point of time, you will have someone to guide you. You will not be left alone.
Supervision only. You'll be doing everything under supervision.
I was to PHC on the first day of my posting, and I remember I had attended the session. Sir, I said, if you understand nothing, just give PCT and be complex.
Very safe. Correct.
So I'm like, okay, if I'm not understanding anything, I'll go with PCT and BC, but at the same time, I'll go and discuss the case with my PGs or someone said what to do if the patient comes next. So yeah, you will make mistakes, but at the same time, you should consult your seniors. For example, if it is a like surgery posting or medicine posting, so there also people will be there to guide you. You should just be at calm of your mind, because see, you don't have to handle any repercussions yourself. It will be your consultants on your above. So you just have to go, like you just have to learn.
There's a saying, Anjali, great power comes with great responsibilities. Okay, so now that you have got a new responsibility of being a doctor, automatically you get that power. Okay, the thinking as an undergraduate is totally different from now thinking as a doctor. Okay, but what we suggest you is, yes, you do take decisions for yours in your mind, not openly for the patients. Okay, you making quick decisions. What Anjali meant was, yes, you should decide which is emergency, which is really not. Okay, if you don't have that kind of discretion in your mind, then it's difficult for you. Okay, so at least make a decision that, yes, this is emergency, I should report it to my senior immediately, I should call him. Take help, seek help all the time. Internship, you can minimize your errors only by taking others' help. maybe your friends, maybe by seniors, nurses, anyone's. Call for, always take help. Nothing you are like not demeaning or yourself or anything by taking help from others. Never ever hesitate to take help from others, whomever it may be. Always ask for help, take help. And what she meant was absolutely correct. Always let the seniors take the decisions. Let them tell you, suggest what to do. You do as per their orders. That would be better in the beginning stage,
Yes.
at least initial stages. But when you are posted in the rural setup, in the community medicine postings and all, you individually, you independently, you have to see so many cases. So be if possible, see, or else just refer to the higher center. That would be better. Okay, don't think that you are the supernatural power and I'll cure everything. Don't have that kind of notion. Always play safe, at least in the initial period. Okay, having said that, I don't mean that you be always be so defensive for everyone, just prescribe paracetamol. No.
No.
Okay, you have all the knowledge. You have all the knowledge now, because now it's a time to diagnose the patients. You all know all about so many syndromes, everything. Now try to elicit, yes, whether this patient can have that. Okay, so and I would like to suggest you one thing to all my interns. This now clinical this thing is, scenarios are totally different from what you studied from your books. All atypical presentations you get. Fever that crackles, you will not find in any even then it will be pneumonia, like that. Okay, so don't expect all the bookish symptoms or signs in any patients. It all be mixed up, jumbled up, because they would have taken half a medicine course of medicines, and then they would have come with some rash here. By then it will not look like a typical psoriasis. It will look something differently. Even then it will be psoriasis only. Okay, they would have applied some herbal medicines over that, and then they'll come to you. Then you can't say this is out of my syllabus or I never read anything like this. No. Okay, so use your common sense. Many times common sense prevails. You need not have a big knowledge to be a good doctor. Okay, many times common sense will prevail. Okay, so with that, Nandini, how did you manage stress and working everything in
So
your
I
setup?
actually have a theory about this. That's why when they asked this question, I asked if I could handle this. I think like there was this internal struggle for me with toxicity of internship, because at one point I was wondering whether it is internship that's the problem or is it just me. So I think both of it is true, because as I said before, you've just never been accountable for anything. Like I remember in fourth year, we were introduced these new 8 a.m. theory classes. During Saturdays, I would calculate saying, okay, you know what? I need 75% attendance. It's fine. I can bunk all the Saturday morning classes and I'll still manage. So the thing is, I could just wake up Saturday morning, roll over and go back to sleep. But the thing with internship is your presence is accounted for. Like people depend on you, patients depend on you. And that kind of a scenario you've never been in before. So it may seem like it's toxic, because if you're not there, obviously PGs are going to be mad at you, professors are going to be mad at you. All of that will translate into toxicity, because maybe 1 or 2 days your co-interns will cover up for you, but no, how long can they be accountable for you, right? So all of this translates into toxicity. So most of it is just you and your perspective. And as far as what Anjali was talking about decisions, it's very true that you're not the decision maker. It's usually your seniors. But there are some instances, like for example, in my medicine posting, I had a wonderful PG who was the head of my unit, and he told us that if there's any test below 500 rupees, go ahead, you can order it on your own. Don't take my permission, as far as you can give me a well-reasoned argument. As far as you can tell me that so these were the signs and symptoms. This is why I felt like this. I have to order this test, and I placed it. I made the patient pay for it. I've given the blood sample. Here's the result. As far as you and your result and everything can be accountable for. So if you work towards it, your seniors will be more than willing to give you opportunities and help you out and see you flourish. So decision making, obviously it's them, but then all these small things will matter as to how you're perceived as a doctor. So even when you're ordering all these things, there'll be a different confidence that the patient has in you, because you seem like a doctor who's actually working on them, who's responsible for them. So they'll open up more to you. Because in the beginning, I would see how like sometimes the patient would just like fail to tell me a lot of signs and symptoms. I'd be like, I asked you all of these questions. Why didn't you answer this? Why didn't you give me this history? Why are you only telling my professor? Because it is very embarrassing where you have gone through all of the history and the signs and symptoms with the patient, and he's happily stood there and said no, but as soon as the rounds start, he'll start giving 200 different symptoms. So that's because he just thinks that, you're not necessary enough or vital enough to the process that he needs to repeat himself. But, like if you go and you're persistent and you're there for them, they will actually open up to you more than you can imagine.
Anjali,
and one more thing, sir, I wanted to add on. If a patient comes to a government hospital, they will give like 2,000 complaints. Everything they will tell from head to toe. It's
HPD syndrome. We call it as HPD syndrome. Hatha Pama Dar syndrome. Okay, they will have from.
Everything they will have from head to toe. It's you who have to decide what to treat, what is psychological. Because, like for example, if I start treating everything head. So many medications it will be. You just have to elicit it. That art you have to learn in internship, in government setup.
Yeah, no. Anyway, because 75% of the, remember my dear friends, 75% of the problems are just psychological. Okay, only 25% you need to treat. Remember, every Tom, Dick and Harry you need not have to treat. Many times just pat on their back and telling that, no, dear, you're all right. You don't have any problem. You'll be all right soon. Just that you are feeling little low today. Come on, you can be better. So just kind of some consolation from your doctor's side, more than enough to many, especially elderly people, they'll be just doing hospital rounds every alternate day. So just a pat on their back and telling, Aja, you don't have any problem. You are very strong. You will definitely beat century. You tell them, then more than happy, they'll go back home. So you need not have to treat every patient. Just give them reassurance. 75% of them are psychological illnesses. So take it that way. Okay. So Anjali, what according to you are the most common mistakes done by intern as an
Just
intern?
a second, sir. Just a second. You're not audible again, same issue. Sir, you carry on with Nandini, I'll come back.
Yeah, Nandini. Yeah. What are the most common, in general, mistakes done by any interns?
So I don't know if I would call it mistake, but I think somewhere in between what happened with me was I got fed up with it. Like I felt overburdened and I just wanted to like relax for some time, and I just wanted to do whatever work was there, not get involved, and then just go back home, like get done with my work and leave. So I think that's where you lose out, because there are so many cases and opportunities that you get, and then all of a sudden, just because you would have done the SCUT work, the clerical work, doing stitches, doing sutures, doing blood draws, all of that is important, but actually analyzing the case is of the utmost importance. So I feel like we get so lost upon like running behind all these small procedures that we forget to actually look at the patient as a whole. So that was one of the things I discussed in comparison to one of my friends who studied in MMC, where he told me that he would have hundreds of patients, and I'm in a private college, so I have the luxury of having a fewer number of patients. So sometimes they would allot each intern a few cases, and I would see that case from the beginning to the end. Correct. So I feel like this is not a mistake as a whole, but I feel like my experience was that if you have the opportunity to see a patient from the beginning to the end, even if you're really busy, even if you have a lot of other things to do, take that opportunity. Like try to follow a patient from the beginning till their discharge, because once you experience a case, you never forget it.
Perfect. See, I want to add, tell the same thing. The difference between your UG posting and internship is, there you were just getting glimpse of the case. Okay, you are coming suddenly one day, you will see the patient and go back. You don't know how he came, how he went. You don't know. Okay, just one day you are a part of that patient. But in your internship, from the beginning, admissions to discharge, you'll be with the patient, in and out. So you know what's really happening with the entire case, how we presented, how we investigated, how we diagnosed, how we treated, and how we got better, and how we went. Everything, even for follow-up, you will come to you whenever you are there. So the beauty here is you will see the entire case management. And like Nandini mentioned, that will get imprinted in your minds. Whatever you have seen, whatever you read may forgotten. Whatever you have seen, whatever you have performed, whatever you yourself have experienced there, will be never forgotten.
True, sir, true.
Clear.
And sometimes
so
even
be the part of that experience. be the part of that entire experience. Don't miss out any part. That's what Nandini was telling. Okay, you just do your part and leave that for the day. You feel exhausted. You miss out the major chunk of the major management or the patient's progress maybe. So take part in the entire process, and we try to be part of that process as much as possible, and experience that will definitely come in handy in future. Don't think that I'm going to be a radiologist, so I don't want all these things. I'll just see x-rays and learn, and I'll finish off my job and I'll go. No. Okay, no. So
And so one more thing I wanted to add on.
More, I'll tell you, summarize everything in one internship and enter internship in one sentence. If I want to do that, more you sweat during practice, less you bleed in the battle. My dear friends, please make a note. More you sweat during this is your practice. More you work hard, more you sweat here, less you bleed during a real battle. That's when you come out of the hospital as a consultant. Like tomorrow you'll be a surgeon or pediatrician, whatever. You'll be working independently. Then you will not have any hesitations or any confidence, lack of confidence, nothing. Because you have worked hard, you have gained enough confidence, exposure, everything. Now when you come out, you can take all kind of decisions. You have seen all kind of complications. You have managed them under the supervision of some seniors. Now when it comes to you, as a independently, you can manage. So, but now if you escape and do this kind of this thing during internship, later on you will face the bad consequences of them, surely. Okay. So next question to Dr. Anjali is that third piece prepared, preparing for the future. So not just working, internship is definitely part of the curriculum. We have to all undergo that, but future is also ahead. We have to prepare ourselves for the post graduation. So big entrance exam is there, a big hurdle. So how do you prepare yourself during internship? Of course, before that you would have prepared, and now how do what do you want to say about that?
So it depends upon the posting in which you are in. For example, you're in a posting, medicine, surgery. That time you won't have much major luxury of time. So at that time, you can at least solve previous questions whenever you're getting time. Say, for example, shifting the patient. You have 5 minutes with you. That 5 minutes you can utilize to solve the question bank. Something you will get. It should not be like hectic postings are there. I will leave studying now, and later I will cover it up. Never it should be like that. And in hectic postings, you can cover your shorter subjects, and in lighter postings, you can cover your major subjects. So if the approach is like that, plus the other approach I personally like is you see a patient, for example, some congestive cardiac failure patient you have seen. So when you go and read about the anatomy, physiology, pathology of heart, you will be more interested. You will learn at a faster pace. And at the same time, when you see the same thing in the patient, it gets imbibed in your brain. So in major portions like medicine is there. Almost whatever is asked in entrance, it comes from the wards, what I personally feel.
So these days, they're asking more of these kind of questions, only USMLE based questions, case based scenarios they're asking. So all these real life scenarios you would have seen, you would have attempted them in your postings. So same kind of questions comes in your examination. You can attempt them with confidence. So what I would like to say, Anjali, is 3 things. Okay, one, what major posting, minor posting, whatever she told was correct. What I would like to suggest is, when you are in that particular posting, read about that. Okay, when you are in a surgery posting, read about surgery. When you're medicine posting, read about medicine. So what happens, 3 advantages. One, you will have a target. Yes, 1.5 months of surgery postings I have to finish this book within this time. One thing is that you will have a target, or else you'll be keep reading. Today I read a half an hour, I'm exhausted. Tomorrow I'll read 1 hour. You'll keep giving excuses. Otherwise, you will have I have 1,000 pages. I have to finish in 1.5 months. Then you will have a target and you will try to reach that. Second advantage is, like Anjali mentioned, when there is a case, surgery case, pancreatitis case is there, and you have read all about pancreatitis and gone there. Okay. Now, two advantages. If you have while studying, if you get any doubts or any clarifications required, immediately you can approach your PGs or consultants, then clarify then and there itself. Third thing, Of course, in the rounds, there will be discussion about the pancreatitis, and questions will be invariably posed to you, and you can answer them, everything. And what will happen to your confidence levels? Swathi?
Yes, definitely it will
Right?
be.
You're understanding? You're understanding? Okay. Just answering right and left. Say, this is that sign, this is that sign, this is that sign, and or else just keeping mum like this. You ask whatever. I'm just an intern here, right? To write the case sheet. I'm not going to answer anything. What will be the mindset of a student who is answering everything in front of the professors and another who is keeping mum? You understanding the difference? So what Anjali told is 100% correct. Read about that particular case. I told you in the beginning. Any interesting cases are there? Any good cases are there in that? What? Just be prepared with that. When the examiner is professor is asking the questions at you, so you can answer them. Your confidence will build up. Others will come down.
And one more thing, sir, I wanted to add on.
Competitive world. Okay.
Sir, one more thing I wanted to add on. Like the basic blood you withdraw, the EDTA tube, the which tube you use, even that has questions on it. Like which, like if PG entrance you're focusing, even
color codes, all this cannulas, whatever, which color is
catheter, everything has questions.
What I'm telling is, don't do anything mechanically or just for the sake of mechanic. No, with everything you do, try to learn from that. Yes, I'm using 16 French catheter for this patient. Why I'm not using 14? Why I'm not using 18 here? What is the color? See, be totally involved there. Don't just do mechanically just for the sake of doing it. You understood? That practical learning only will try to answer most of your questions in the exams. Okay, so one reading, my suggestion would be, during that particular posting, try to finish off that subject. And when you get minor postings, like for say some ophthalmology, ENT or so, that time you can finish off 2-3 subjects, even the preclinical, paraclinical. Some forensic medicine postings may be very, very free time. That time you can finish off 2-3 subjects. So advantage is you'll have a target. Second is you can clarify your doubts from the seniors or the consultants there itself. Third thing is you'll boost your confidence levels by answering in the rounds or during the postings there. Okay, so this is this is how you will prepare for entrance exam, and don't waste your time there chit chatting with your 2-3 interns will be posted in a branch or in a unit. When you are sitting together with no work, definitely you can't carry a book there to the wards. So you will have anyway, you will have your mobiles. Spend your time for solving as many MCQs as possible. Swathi, Aditya, my suggestion is, this is your, this should be your goal. Every day, whatever it may be, how much or hectic the posting is, whatever it is, I'm going to solve 100 MCQs per day at any cost. From the day one, I'm going to solve. I don't want to get all the right MCQs, or I don't want to get everything right. No, just I'll keep solving. This irrespective of what the answer is, I know or not, I'll be keep solving every day minimum 50 MCQs. That should be your goal from the day one. Clear? Solving MCQ is an art. See, theory, you are number one. All three of you are all number ones here. No doubt about that. But MCQs is total different ball game altogether.
And MCQs also, sir, previous year question should be focused mainly. First, if you finish previous year question, then you should solve random MCQs. Like MCQs also quality matters.
Yeah, so you will get an idea. See, MCQ solving is not for a knowledge purpose. Don't expect the same questions in your, if you solve 500 questions, same 100 questions will come from that. No, you don't expect like that. Why you are solving is to get an idea. It's an art. Any art can be mastered only by practice. So what kind of questions they're asking? When I'm studying, where I should focus on, from which nook and corner they are framing the questions, how they're twisting the questions, how to rule out the option and come to a conclusion. Everything you will understand only by practice, only by solving as many MCQs as possible. It's not that you have read the entire syllabus 10 times and today is the exam, you go and answer everything. Not possible. Never that way. If you practice solving MCQs, only then you can give a good test and get good results. Clear? So whenever, like Anjali mentioned very well, you have before shifting or when waiting for the lab reports, you have 5-10 minutes time. Spend it for solving MCQs, not for just chit chatting. That's how you can maximize the utilization of time. Nandini, you agree with me? How did you prepare yourself during internship?
Sir, I am thoroughly. Yeah, but I am thoroughly guilty of chit-chatting. I have always, I never actually was that productive within the confines of the hospital. I just talk to my friends, gossip with my co-interns, I gossip with my professors, my PGs, everything. Because I just feel like when you're with somebody for so long, there's a way to like friendship just blossoms and all of this happens with it. But for me, more than like, I think they covered all the basics, but what I would do is make a game out of everything. Like I had my study partner, so even now while we're preparing for our exams, we do this thing like every day I'll study 5 drugs. Like apart from whatever your normal timetable is, every day we do 5 drugs. Every day we have to do 2 oncogenes. Every day we have to do like maybe like the 2 microorganisms, and it would be very system wise. For example, let's say if you take just community acquired pneumonias, which is the most common cause of community acquired pneumonia. Second, like strep pneumo is the most common, then Moraxella catarrhalis, then I think Legionella pneumophila. So all of these, like as soon as we look at each other, we'd ask one question like, hey, what's chronic pancreatitis causes? Like, and then we'd be like, and then we had all these mnemonics like, oh, pancreatitis, I get smashed. Okay, so that's idiopathic, gallstones, ethanol, trauma. And we keep like asking, we make a game out of most of it. And then we'd keep trying to make mnemonics or like 5 drugs every day or 5 oncogenes every day. And then we try to make like various connections with each thing. Like recently I was watching this video on biochemistry, and they try to integrate Game of Thrones into remembering the catecholamine synthesis. So it's actually, it goes like phenylalanine, tyrosine, and dopa decarboxylase. So it was like Peter Dinklage plays Tyrion Lannister, who's very dope. So PTD. And like we just find fun ways to remember different things, and somehow in your mind when you experience it, your brain is, the chemistry of your brain is that you will remember experiences more than facts. So when you experience something, it just sits in your head much better.
Wonderful.
So this is just one thing that I would do. Like, and also Kishan sir, like I remember the first time we met, I think I was in 3rd year, and then we were all like, all the co-members were sitting, and Kishan sir just put his fist down and said, every one of you must solve MCQs every day, every day. And so that's like, I think the gold standard. Other than that, I think you should take internship as an opportunity to make friends and study partners and have fun. Like in this way, because your work is so stressful and so demanding, at least your study will be fun.
Study, enjoy studying. Okay.
I don't know if you can enjoy
got a deep meaning into it. That's got a deep meaning. You just check. Okay, later. Study, enjoy.
Study.
Anjali, many say that many interns complain that internship all about just some clerical work. I just do this group D work only. I never feel like a doctor here. So is it true, really true in a government setup? Do you really feel so, or you make it for yourself?
So it depends upon how you take a situation. Everything has positive and negative sides. For example, writing discharge cards. It is a clerical work, but from that also you can derive a lot of knowledge. For example, in a discharge card, you will have the diagnosis of the patient. What are the investigations we did? What are the values of it? The treatment we gave to the patient, and what is the further advice? Just by writing one discharge card, one diagnosis, everything you will get. But yeah, it becomes a tedious process in long term. But it actually depends upon how you take it. For example, taking the patient for ultrasonography. When you take the patient for USG, you can talk to the radiologist. Okay, how we are doing, what signs you are seeing, how we can do. Like you can learn from the radiologist.
Instead of just putting the patient inside and waiting outside, you can really get involved yourself there. Although you may not understand anything, try to watch the shades of white and black there. Okay, at least somewhere it will come in handy. Don't waste your time. Don't just think that you are just pulling the patient into the radiology room. No, that's not. This is a good opportunity to learn the radiology. You feel think like that and go there with the patient. Try to grab the opportunity there to learn from a radiologist.
CT scan technicians have so much to teach. Like they also know the basic. Like if you go inside, you can just learn, okay, how the CT scan work, like how you can, like basic things you can interpret in CT scan. Even the CT scan technicians have a lot to teach. X-ray technicians have a lot to teach. It's just that you should be open to learn from anybody. But yeah, in a government setup, you have a lot of clerical work to do. No escape to that. But it depends upon how you take it.
Nandini, what's your take on that? Is it only internship is only clerical work, or yeah, much beyond that?
So I think that it's necessary that we do the clerical work, because only then we can appreciate the entire process. Because I think this is the only time you'll do it, because then you'll be a PG, then you'll be a consultant, and no one is going to go ask you to do discharge summaries as a consultant. So, but the whole thing is, it is a process. There are many things that you learn like while doing the discharge summary. So I think you can't completely escape this clerical work, and we're all human. You can't actually enjoy everything. I think it's just a part and parcel of the job. You accept it, you try to make the best of it. Sometimes, even if you love something, you will complain about it. We all love medicine, but internship will give you plenty of opportunities to complain and cry about medicine. So I think you just enjoy the entire process. And
very
I
mature
think like
and
opportunities,
yeah,
and opportunities come.
Opportunities, I'll talk. Okay, see, there is nothing called, according to me, government setup is better, private is not good, or private is very good to learn the recent the trends and all. Nothing like that. So wherever you are, you will get patients. Only here you will get 4 patients, here you will get 1 patient. That's the difference. But learning can happen better here also. Need not be always with the 4 patients. 4 patients you will learn 10%, and in 1 patient you will learn 100%, which is better. Okay, so don't think that I'm in a private setup, I don't have patients here, what can I learn here? No, nothing of that sort. 1 patient is there, it's a golden opportunity for you to learn entire things, because you have a lot of time and energy is there, and no unnecessary works, everything. So you can spend all your time on 1 patient and learn entirely. Here what happens, you have 4 patients, but when you're looking at the 1 patient, can't manage everything. Other way of looking at it, by seeing 4 patients, you become more experienced. Okay, government setup, enjoy. How can they take it positively? Government, see, okay, I may be doing the things clerically or mechanically, but what happened? I am seeing the same similar cases repeatedly. So what's happening to my synapses? They're becoming more stronger. My experience is getting like right. So that's the way of look. Instead of cribbing that, oh, same COPD case, my God, same in my cases, how many, same OP poisoning cases, how many comes? No, no need how to crib like that. It's definitely why the advantage with those who done in government setup is their confidence levels will be very high. They would have seen
practice, the more perfect we become.
Yes, exactly. That's what Anjali says. But our Nandini is a perfectionist. She wants to do everything perfectly. She will go methodic. In 1 patient.
Actually, sir, I think I have a very controversial story about this, because when I say opportunities, I mean that it comes in all sorts of weirdly wrapped packages. Because for me, when I was, again, it's a very bad story, and please don't take my example for it, but when I was posted for my community medicine CHC postings, we had 2 night duties. Every intern was getting 2 night duties, and in one particular election day night duty, 2 of us were posted in for night duty. But usually only 1 intern is enough, is what everyone says. So me and my friend who were posted, we did a few discussions, and we said, you know what, no one's going to get to know. You come on one day and I'll come on one day. No one will get to know. So the first night I did not come, and they found out. So the main head of the CHC called me, and then she yelled at me, and then she gave me 15 days night duty continuously. So in the beginning, I was horrified at it, but in the end, it was like a blessing for me, because coming from a private setup, you don't get a lot of opportunities to do deliveries. But because I did about, I think in the end, they shortened it, and I only did about 9 days of night duty, but it was wonderful, because I got to be like best friends with the sisters who were on duty, and they let me do everything. I saw cases like meconium stained lacquer. I saw like breech delivery, and then I actually got to remove the, like when they're looping around the neck, I got to remove the loop. A lot of the things that I would have never been able to do in my college, because in a private setup they're a little bit more litigious in their processes. So, but in the government setup, their sisters like, yeah, go do it, it's fine, I'll sleep, you do it. And it came as obviously a punishment, but those 9 days were so amazing that when they asked me to stay back for an extra day, I was more than happy to stay back for another 10th day of night duty. So all I'm saying is, like, you will have very weird scenarios in internship, but somehow you can make the best of everything. Because I got to see so many different cases throughout. Like sometimes there were like 4 or 5 deliveries in one night, and it was just like one of the best times, because I not only did I get to have all these experience, I got to miss all this NCD and pharmacy, which you are otherwise posted in CHC. I got to miss all of that. So
listening to you both, all our members are scared now. What is this internship? Just work all the time. Some is telling clerical work, some is telling delivery work. So only work. What is this? I meant to work like a donkey or what? I'm a doctor. So there is no fun in this entire year. There is no outing. There is no treats. There is no movies. There is no APL or something. Nothing. No, nothing of that sort. Anjali.
It's
only
there, sir. It's there,
I'm a
sir.
robot.
No. Internship is the golden period of your life, I would say. I still remember how I used to sneak out at 3 o'clock for tea with my PVs. My college is at place where we have sea also, river also, waterfall also. So at any point of time we are getting bored, we'll just sneak out. So I have personally sneaked out a lot. Goa is just like 40 kilometers from my college. So we're getting bored, we used to go to Goa. So it's not like just working. It's just balance of everything. You will have times to enjoy with people. You will have time to party. It's just should be a balance of everything. It should not be like people think I am an internship. Finally, I have studied so much. So full internship, I will enjoy. It should not be the case like that. It should be like you should work in balance. That's what. Even I have enjoyed my internship. Even I have gone to so many trips. I have gone to
Really?
Mangalore,
You look
Shimoga.
like a nerd and what's a very studious girl. Huh?
Sir, I have came to Mangalore recently. Mangalore, I have gone Shimoga, I have gone Goa to Delhi.
So it's possible. It's possible even to have fun amidst your hectic duties and schedules, right? So even the PGs will take you for treats every weekly once or twice, or you will have a unit get-togethers, the parties, movies, everything. Okay, that is also part of your internship, not just even the games. A lot of
Periphery, so it will be luxury. You will be treated like the boss of the taluka. You will be given all the facilities, all parties at big places. So it's nice.
Nandini?
So I actually made it my prerogative to have fun, because this was the last year that you get to spend in college. So I wanted to have fun with all my friends. Like I wanted to go out every day, and there were like certain weeks where I was going out every single day. But the thing is, like, you'd study for a while and go out in the evening. It was like that. But also because I think everyone thinks if you're a medical student, you have to be very nerdy. You don't have fun. So I think you should make sure that you are a well-rounded person. So having fun is a big part of that. Like having interests. Like I try to play TT. I really like TT, so I would try to play TT, or I would go out and find something else to do with my friends. Like we'd go to the library, study for a while, and then we'd go to an escape room. So I think I don't think there's no way that you won't have fun in internship. Like you have been given this golden opportunities and a stipend, so it will be a lot of fun.
Lot of fun. In fact, lot of many funny moments you'll face because your friend did one of my friends, like to example, okay, one of my friends, what he did, he collected 2 samples at once. Okay, instead of he has to take 1 sample now, and after 2 hours again he has to collect another sample. Instead, he collected 2 samples at once and sent 1 FPS now, and after 2 hours he sent another PPVBS sample. So This was a big joke of entire internship. So many jokes like that, rumors and funny moments you'll come across. So okay, so someone was conducting delivery and some liquor splashed over his face. That will become a like a laughing moment for all entire batch. Okay, so a lot of fun, Internship is fun. Okay, really, it's not that just studying or some clerical work like that. So now Aditya's face is some glitter is there now. I think I noted he's jotting down so many things. So Aditya, now do you have any questions at the end now?
I did have a few things to ask.
Sure, you
Uh,
can directly ask them.
yeah, one thing I would like to ask is, are there any gadgets slash tools that we should have in internship that make us more efficient? Things like, I mean, I have heard of it, like ampule cutters. It's a very general question, but I guess we
Correct.
all.
See, nothing wrong.
Yeah.
Nothing wrong in having them. Okay, see, all these what is the definition of instrument or tool? Whichever what is the definition of instrument? Whenever I take this class on instruments, my first question is, what is an instrument? Instrument is a tool which eases your work. Anything which can ease your work is an instrument, so you can definitely use them. If you should be like I feel you should be advanced in whatever the technology you have. You should utilize them for your benefit. It will definitely benefit others also around you. So there's nothing specific like you should use this ampoule cutters only, you should have this only. Like whatever usually you should carry as a UG, same thing you'll be carrying here. Okay, nothing else. Maybe one extra pair of aprons, maybe, because every day it gets dirty, and don't carry, because that is the one storehouse of all the bacteria, staphylococcus, pseudomonas, everything. So I would suggest you to have some two extra pair of aprons and keep it clean, because many nosocomial infections, everything spread via that only. And avoid wearing unnecessary this ornaments, watches, etc., because they're again the collection centers of all your bacteria, and they're the nidus. So try avoid using them also. But gadget wise, this one smartphone is more than enough. It will come very handy to know the doses. Everything nowadays available online. Okay, no, you not have to carry any books or anything. So to know the doses, to at least Google Lens is there. You can use that. So all these gadgets will come in handy. And other than that, any specific instrument did you use, Anjali, in your internship?
Like for example, in OBG posting, there is an app called OG Wheel that they made us use, like to calculate the gestational age and all. Other than that, I had one PDF from Trivandrum Medical College. I got that. In that, every like basic management was written for every diseases. So that became helpful for me when I was in periphery. Nobody was there to guide me. I used to just refer it and I used to go ahead. So small things I use, and then no specific instrument. One smartphone is enough, I feel.
Correct. Nandini, any specific instrument?
No, so I was never sophisticated enough to carry separate instruments, because like I feel like I have a very rugged approach. Whenever I was in the CHC, you have to break like 300, 400 ampoules a day. Just take a bit of gauze, wrap it around, break it in the correct manner, you're done. Or like if there's a particularly difficult, stringent ampule, I take a scissor and just like tease the head of the ampoule and then cut it. So maybe you need a scissor that will help with everything. And then as far as other facilitations happen, like again, whenever you're interested, like I was very interested in pediatrics, so I bought that Meherban Singh doses book, the pediatric dose book, and then I would do like 5 every day.
What I would suggest is be very cautious or careful when you touch see any patients. Okay, consider every patient as a potential threat. Okay, so in a sense, take all the precautions. In my days in government setup, we hardly get any gloves or anything. You can carry your own set of gloves. Keep in your apron pockets. Keep some 10 pairs of disposable gloves. Before touching any bandages, before touching any wounds, before touching any patient with cough and all, wear one mask or gloves. This will not just safeguard you, but when you go back home, all your like elderly people at home or small kids at home, they will also get prevented from major risks. So as a very concerned senior, I would suggest you to carry your own. Don't rely on the gloves or masks available in the hospitals. Instead, you carry your own scrubs, your own gloves, pair of gloves, disposable gloves in the pockets. It may be 100 rupees extra you are paying. but that will save you from a lot of infections, lot of communicable diseases, and you're carrying a lot of, you may be competent, but many around you may be immunosuppressed. Okay,
So
you
to build
understand?
on that, I was just going to ask the same thing. Any sort of PP we should keep handy if we're like dealing with patients, especially
Gloves.
post-COVID. I think
PPV and all, just that's mask and gloves is
yeah.
more than enough, I feel. And
And
keep
post-COVID,
washing your
every
hands, hand
hospital,
washing.
yeah. Post-COVID, every hospital room is like mandated to have a sanitizer, so you don't have to worry. And
Yeah.
one more thing
Yeah, yeah.
is, one more thing about opportunities was, I remember that but during pediatrics, I came up with this trick where every day in the morning, I would find out who the labor duty intern was. I would call her and give my number and said, listen, if there's a delivery, I should get the call first, not the PT. So as soon as there was a delivery, like 30 minutes before, I'd get a call saying there's a delivery. And I would go down and I would be like, sir, I want to do the receiving of the neonate. I want to do it. I would annoy them so much that they'd be like, okay, fine, let her come and let her do it. It's fine, I'll just stand. And the thing with I would do this not just when I was in pediatrics, even I think when I was in respiratory medicine, opthal, because those are the postings where you'll have a lot of freedom, where you can actually steal away 30 minutes to go down to the labor room, do this and come back, and no one will know, be none the wiser. So, and small things actually was impressing the professors, not only that you knew how to like do the procedure, small things like when you do like receiving a neonate 7 times, what happens is you'll know that before you put the stethoscope on the kid, you need to first warm it up. And those are the small things that they would actually observe about you and know that, oh, this one knows it, she knows how to do it. The way you pick up the baby, or the way you handle the patient during a test, which side of the patient are you standing, how confidently, before you touch the patient, you know who the patient is, you explain the procedure to them, make sure they're comfortable instead of just dealing with them like they're like medical dummies. So all of this was something that I was really interested in.
Yeah. To answer Aditya's question, yes, no need to have separate kits or anything to need not carry. So in such conditions, hospital only will provide you. From your side, you carry one safe mask and gloves. That is sufficient. Okay, and take wherever it's possible. Take necessary precautions. Don't simply go when professor is yelling at you, go do the dressing. Don't hurriedly go and touch the patient with bare hands. Okay, don't do such things. Always first take care of yourself. Then comes the like anything like rest of the things. Okay, so that's the one thing. Any other doubts quickly?
Oh, and also getting pricked by especially when you're working in a CHC or
before
something,
starting internship, all of you must receive hepatitis B vaccines. Today, if you're not taken, tomorrow only you go take it. Okay, hepatitis B vaccine is a must. Okay, and we know that how to prevent injury, like prick injuries. If you already got pricked, nothing to get panicked. Okay, and how to go about that, know it beforehand. These are the common things. Needle pricks, or when cutting the ampules, you get cut. So all these things are very common. So just go through some videos or some relevant resources to how to overcome them, or what you'll do in such scenarios if you come across. Okay, know about that.
And there's also like an important thing to do is make sure that you check the file, because if there are like a HIV positive or a HPSAG positive patient, they usually write it on big letters on the file or somewhere. Like they make sure that it's very evidently known that this patient has such a condition. So make sure you're aware of it. So please do not give the like injection and then go to cap that injection. Like, so if you're aware of it that this is an immunocompromised patient, just like throw it away. It's fine. You don't have to follow protocol that in those syringes. Make sure you're safe and throw it away.
Sir, regarding preparation, internship is not a race. It is a journey of 1 year. So I want to learn from our seniors that how to maintain the consistency with the studies, and especially the hectic posting, how to deal with that.
Okay.
See, Anjali.
The hectic postings, as I said before only, it's very difficult for you to maintain the consistency. But just the flow is not broken. You should just keep solving the question banks. And just you should be like, okay, I have seen this case. I have to go and read. At least if 10 minutes you can spare for reading for the case what you have seen, it will keep adding on it. It's very difficult to maintain Consistency in hectic.
The consistency is not in time, okay, but in touch with the being in touch with the books. Okay, that's what consistency. 10 minutes or 10 hours doesn't matter. You should be in touch with the books every day. You had a very hard day today. At least before sleep, make sure that you at least solve 10-20 MCQs or go through important 2 charts that day. Enough. Because if you're in touch with the books, you get a free day. You can make the best utilization of the entire day. If you are not in touch with the books, and hectic posting is going on, 1 week you are not read, suddenly you get 2 days break, you don't feel like opening the books at all or opening and studying at all. You feel like again relaxing. That way you lose your 2 important precious days also. So being in touch with the books or your study materials is very, very important. That's what I mean by consistency here. 10 minutes, 10 hours doesn't matter. Okay, be in touch with the books every day. Before going to sleep that day, you make sure that you solve minimum how many questions?
100.
Hriday?
100.
Sorry, Hriday?
100.
100 MCQs per day. I'll sleep little less today. I'll manage it tomorrow somehow. But I'll never compromise with solving MCQs. Minimum 100 MCQs per day. That's the rule number 1. Any other questions? Next, please.
Ma'am, after long hours of duty, as you mentioned, we may have to skip meals, like not eat food in between. So if such thing happens, how do you cope up with it, and how do you still be cheerful and carry out all the activities, like if such thing happens?
See,
Nandini?
you should definitely have something in your bag to have. It's not like it's internship. It's not possible to have proper 3 meals a day. You should have something, be it biscuit or anything, to keep your energy.
Dry fruits are the
Anything.
best.
I remember Kishan sir told us that make sure you have a box of dry fruits in your bag every day.
At least always carry, because it's impossible. Early morning you have to suddenly rush to hospital at 7 o'clock. It's not possible to have a proper breakfast or anything. But make sure that you eat something and only then go to the hospital. Okay, always it's best habit to keep one box or some dry fruits with you, especially dates and all. That will give you instant energy and also enough proteins for the day. Okay, so when you're running through, wherever you find some cafeteria or something, go have something. Okay, at least if not a proper meal or lunch as such, have something at that particular time. Okay,
and also not having breakfast is the perfect excuse that you can give your PGs, because after rounds you'd be like, sir, breakfast in the sir, and then like 3 of us would vanish for 1 hour to just go have breakfast and come at the nearby cafe. So everything has its perks.
Be frank. Don't hide having not having breakfast and keeping mom is doesn't serve the purpose. Tell sir, we have not had the breakfast. Telling it's not a crime to admit that you have not had. Sir, I could not have the breakfast in the morning. Can I have just 10 minutes? Be open with them. Okay, they're also human beings. They understand. They also have gone through the same phase. Okay, nobody wants to torture you like that. Okay, just that make sure that you finish off your work in some way or the other. Okay, if you're finishing off your or then whatever you do, nobody's worried. If you're only just like Nandini, you are for 10 minutes, you go out and come after 2 hours and work is not done, then you get blastings. Okay, don't do like that.
And so don't be too much workaholic that you end up spoiling your own health. Like many people are like, they will do their work also, they'll do 5 other interns work also, and then end up spoiling their own health. You should first prioritize yourself in the long run.
If you are healthy, you can take care of others' health.
Yeah.
Any other doubts or yes, Aditya?
So just like to add on that,
Please.
we have recently heard as doctors, we'll be advising everybody to have healthy diets and eat
Don't
healthy.
follow.
And we are the biggest hypocrites when it comes to diet. We take all sorts of unhealthy foods, fast foods, just to save time. So any suggestions on how things we can avoid to not get into that circle of bad diet and bad health?
We can have healthy alternatives to it.
No, I think what you're looking at is like an ideal scenario where you're very good with your internship work, you're very good at studies, you're very good with your extracurriculars, you're very good with your health. It doesn't happen like that. Ideality isn't real. You can't realize it that way, right? So it's fine, you take a few cheat days where you wake up in the morning and your first breakfast is like a burger. It's fine. Just make
No,
sure that
madam.
some
Nandini,
things.
nothing wrong being idealistic or nothing wrong in being perfect. Okay, he's correct. Whatever he's asked is correct. You need not have to be like some excuses like that. Aditya, see about the food. You want to know about the food, right?
Yes, sir.
Yeah.
I just
What
one
doctors?
small thing I would
I
like
always
to.
give. Many patients ask me, okay, sir, you tell me not to drink, not to smoke, but doctors are the one who drinks the most. They ask me. Then I want to tell you it's correct. But how do I substantiate this? You drink some raw things, but the doctors drink very purified form, or what to say, very very good
Fresh.
so good brands. So see, what you eat is not important. Whether it carries enough calories or not, that's what important. So carry some proteinaceous diet with you, some like whatever burgers, whatever you like. Okay, eat it, but make sure that you eat, because what you should keep in your mind in internship is we are all carriers of something. What is that? We all having one thing in common. What is that? Someone
TB.
already told.
TB.
TB bacilli in us. We are as a medicos, we are medical professionals. We are all harboring one thing in common, that is TB bacilli in us. Okay, if we eat, just like Anjali mentioned, if we eat well and if we maintain our immunity well, then we'll not get affected by it. If not, if you're not eaten well, if you're not maintaining your immunity properly, then you are prone for all kind of. There are so many instances. PGs, interns are. I'm not scaring you people, but be aware of the situation, especially in Mumbai, Maharashtra, and all. So many people, interns or PGs, die because of TB of the spine, of TB abdomen, all those things. Okay, so don't do such ventures of not eating or not maintaining your immunity, and because in hospital you are prone for all kind of secondary infections, and also it's at most requirement to maintain your good health or immunity levels. So eat well. Don't worry about concerned about your looks, appearances, or this thing. Okay, eat well, eat healthy food. Eat healthy food. Once in a while, when you go for parties and all, okay, that's fine,
And
but
like,
not
like
routinely.
what I observed was that a lot of shops around the hospital sell these packed, what is processed foods. And I just happened to see a packet and it was written trans fat, palm oil, like everything that's currently a big culprit in health.
Correct.
So
No, no. So see, no, you know the things, right? You know what's good
yeah,
for you,
yeah,
what's not.
yeah,
So
that's
then follow your conscience. So go with that. Okay. So don't follow heed to others' advices, or don't heed to what others follow, and also follow your own conscience, and whatever you feel good for you, yourself, your health, and your upbringing. Do that. Okay. Yes, Shambhavi has got our again at another active member and one of the um, very good talent I've seen. Shambhavi, yeah, you can unmute yourself and ask a question to our
Um,
mentors.
Good
Yes,
evening,
Shambhavi.
sir. Good
Yes,
evening,
Shambhavi.
ma'ams and all my
Yeah.
batchmates. It was like a really interesting session so far. I had
Can
one
you turn
doubt.
your video, please?
Sir, 1 second. I was actually
Okay.
outside, sir.
Okay,
I'll
fine.
switch it on.
But she
Uh,
makes sure that she's the one name I see in common in all the sessions. Be it whatever the session may be, one name will pop up in the participants list. That is Shambhavi. Okay. Yes, Shambhavi. Please go
Sir,
ahead.
so I had a doubt from both our seniors that there's always a competition between our co-interns when they're posted in different units in the same department, or sometimes even in the same department, that some unit has less workload, so these interns are free. And even in our same unit, some interns, our co-interns, dump all their work on us, and then they take us for granted, and we become like the punching bag of the entire department. So how do we
Hmm.
draw these boundaries, and how do we stay, how do we continue to do our work consistently without becoming the donkey of the department
Why do you
in
want to draw a line? What's the problem in being punching back? What's the problem now, actually?
because
No,
then
no. What's the
No,
you are
but
punching back.
I
No,
understand
no,
her point. Although I would
no, no.
suggest
You can
that she not.
understand, and this is the reality also. But what's wrong in what's the problem in that? I'm asking her. See, let her. When she explore the next step, she will only find, oh, it's nothing big in that. Okay. So what's
So,
the
but I
problem now? You're
actually
punching back.
found certain problems. Like First of all, Shambhavi, I would suggest that you not enter any department or posting prejudiced this way, that I will be the donkey. But then I found out, like, for example, in surgery, if you are so caught up in making discharge summaries, you won't be able to go to the OT. Like, if you are the one who like volunteers or people like, no, sir, I'll get you, I'll like, you'll end up being outside all the time. Or there were certain instances where my friend, she was very meek. So on even there's this practice in our college that even when we have outpatient department like OPD days, one intern has to manage the IPD, right? So even during OPD, she would be the one who's always, and she always end up being in the ward. So I think you just need to voice yourself up and be like, no, you know what, sir, I did this last time. I want to go to the OPD. I need to learn this as well. I'm interested in that. So, it's you can just say no. I think it's politely, in a dignified manner, explain yourself and say no.
Yes.
Because no one can stop you from learning.
Correct. In that way, you should be little self-centered and selfish. Okay, friendship, everything comes next. First is your own this thing. Okay, sometimes saying no solves many problems of your own. Okay, so yes, everything should be equally shared. Today you have done OPD work. Tomorrow you'll be go to the OT. Let her take up the OPD job. You can't doing the same work every day and let others make merry. That's not be possible. So sometimes, yes, but you don't be hesitant to say no, or I can't, or I don't. Okay, be frank with whatever you're doing. Next, any other questions? Very interesting questions.
So one thing I want to ask, sir, one thing I want to ask, that the motivation or the mentality towards the internship is make main difference here. So I want to ask our mentor that they have faced any mental delay, or such as after seeing some death, they face any low day, and how they have overcome that, so that, and how to keep motivation all the time.
Yes,
I think
yes, I will.
For me, so you want to take it?
No. The thing is that it was one of my questions actually. How do you face the patient's loss or how grief actually? But Hriday, you should not take anything personally here. Be it scoldings, be it the loss or whatever it is, should not take anything personally. It's not Hriday. It's anyone in your position would have faced the same thing. Okay, it's your position that matters, not the name or your whatever the. It's not as okay. Don't take it. It's sometimes we feel, oh, because of my mistake that child died. We feel so low when you take it literally, personally. Instead, yes, I did my duty. I'm an intern. Whatever supposed to be done, I have done, or whatever the orders were given, I have followed. It's not the results are not in my hands. I can do only karma, but end results are not in my hands. So take it that way. You just do your work promptly. Should not have any repentings or later. So outcomes you are least bothered about. Okay, but yes, definitely if there are some shortcomings, some mistakes are there, don't repeat them. Try to learn from them instead. You can learn from others' mistakes as well. You should not let it happen for yourself. But never ever take. I'm telling it for everyone here. Even your next PG life also. Never ever take anything personally. If you take such things, you will definitely go into depression soon. Clear? Nandini, you want to add something?
Yeah, like I had this friend, like whenever I would vent to them, they'd ask me this question, is it major? Like, is the problem major? After a certain while, like it kind of inculcated in my brain to such a way that if something happened to me, like even if it's a minor problem that happened between co-interns, or if I got yelled at by my professor, or sometimes there was this one time when a patient asked me, like when I gave him a list of all the like I prescribed a list of everything that he had to buy for his child. He asked me, like, am I using it on his child or am I using it for myself, like keeping it for myself? So you will face all of these issues. Like usually when you think about facing a patient, you only think about the patient and the patient's grievances and the patient's concerns. But also being a doctor, a lot of it is how you deal with the patient's attenders, because you are accountable for the patient's attenders, and that's who you will justify your treatment to. So I think that is also necessary. So sometimes you'll end up getting yelled at by the patient's attenders, and it will be undeservedly so. So I think at the end of the day, you need to ask yourself, was this major? Did it actually affect me? And make sure that you don't carry this to the next day. Because if you carry it to the next day, you'll just be so prejudiced about who you are and what is happening around you. So somehow I think you need to leave the problems of yesterday in yesterday and try to move on. Like,
in the heat of the moment, something can happen. Okay, many people are afraid here. Many beating up happening. Many patients attenders beating up doctors and happening. So you might be very bit scared to face the attenders and all. Don't be. Okay, because it's sometimes our faults also. We would have not communicated well with them. The patient is very bad in a critical condition ICU. We are not communicated well to the patient party, and suddenly you go and tell that patient is dead. How anyone would feel? How anyone would feel? You be in that position and check. If someone is close to you, suddenly you come to know that he's no more. How you will feel? So same thing to them also, right? So that what Anjali was telling, effective communication plays a vital role. You should have prepared their mind well beforehand. Okay, you should have told. You should not, instead of giving full high hopes. No. I will cure everything. I will make them all right. No. Patient is not well. We are trying our best, but nothing can be like assured right now. Mold their brains like that from few days. Okay, any patient can go bad anytime. So suddenly you prepare their mindset like that, and after 6th day you tell, no, we tried our best, then patient is we could not revive him, then they'll be adjusted to that. Suddenly you go and tell that, no, patient is no more, then of course in the heat of the moment you may get blastings, you may get hit. It's not Swathi who is got hit, or it's not the Aditya who is getting scolding. Anyone in your position who has not communicated well or not managed the situation well get the beatings. It's
So
not
even the
Aditya
tone
one
and
person
pitch
to beat.
matters.
Yes,
Even the
it's not
tone and pitch
Aditya I
matters.
want to beat. It's not the Swathi or Hriday I want to beat or scold. It's anyone in that position would have got the same thing. Okay, understood? So nothing personal. Don't take anything personally. What's your fulfill your duties? What your job assigned to you? What are the responsibility are there as an intern? Do it properly, and don't worry about the end results. You will do well. You will not get anything of that sort. Is it clear?
and
Any other
I'd
doubt?
like to add that, like, communication, a vital part of communication is also you being discreet about your patient, because you owe it to them to protect their privacy, and also being able to counsel your emotions. Usually in a government setup, you see a lot of underage pregnancies. You will see a lot of people who have illegally consumed some abortifacients, and then they've come at like 6-7 months of pregnancy, they've taken abortifacient. So you'll find people who have taken pills, or like who have tried to harm themselves. So even while facing such situations, you cannot show judgment, or you cannot show prejudice towards the patient in front of them. Like, whatever your personal beliefs are, you keep it aside, and you try to like counsel yourself, and you just have to like be ready. Like when you go to work, you be ready that whatever happens, I think that's what they mean when they say show empathy, because it's not just showing empathy, it's being able to counsel and keep everything else at bay, like your own human faults at bay, to just be a doctor. I think that is also an important part of communication, not being able to startle the patient.
So one thing I want to ask.
Adding to that,
Yeah,
I think adding to that, we had a very nice EdCom module introduced for our batch onward. That gave us little bit of a primer as to what we should speak, and we also had like these questions, sometimes writing it down, like how we going to talk to the patient. So maybe I guess that we'll have to go through that once before we start.
correct.
True. Like when I was solving these like USMLE questions, there were a lot of questions based on, like, for example, if there's an underage patient with an STD, do you directly go to the parent? Because in these kind of patients, you need parents' consent. Like whenever you think of underage, you always think about parental consent, but there are a lot of intricacies even between that, where your first job and your first dedication is to the patient. So all of this, I think you learned from experience and looking at your seniors, but like be ready to not make the patient feel small in front of you.
So one thing I want to ask that internship is the time when we get some financial freedom. So how to manage our finance? Actually, we are very.
You should have your savings, definitely.
Donate to White Army.
I can't take this question because I did not save anything.
Try to save at least 10 to 20% minimum.
Yeah, you should try to save as much as possible. Enjoy, but some saving should be there, because see, in my time, I'll give my example. In my time, the stipend was very low. We were getting some 15,000, I think 15,000 that time, and we had a bond of 1.5 lakhs. If you don't want to do some rural service, then you have to pay some. I paid that bond from my own that internship money. I saved 1.8 lakh. That's 15,000 into this 1.8 lakh. From that, I paid 1 lakh or 1.5 lakh remaining. But that hostel fees, everything, I never borrowed from the day one of internship. I never borrowed a single rupee from my parents. That's what called financial freedom. You're not again depending on your parents or someone for your basic needs. Okay, so you are matured enough to understand your priorities or basic needs, and you can manage your you can, if you have access, you can start investing. Okay, investing in something. Okay, that we are we already have so many sessions like financial freedom. You can watch that. Okay, from experts, from CAs and all, we have conducted in a White Army for our members, like interns and PG especially. This same topic, financial. It was, what's that, Nandini? You remember? Financial. Some very nice name we had for that. Okay, so financial freedom, or okay, you can look those look at those videos. Any other question, please? We are running out of time. So Aditya or
Sir, are there any since we'll be with the patient from the start to end, are there any research opportunities which you can try so that you can build your CV and
you can try.
Definitely, there are case series you can do. Okay, this case series, a similar case of some 7-8, if you get, you can make a case series out of that, and you can definitely publish. That has got a equal value of that of a research paper. Okay, so some interesting cases you get, you make a case report out of that and go to conferences and publish. Posters you can present. Okay, you can publish also. So I have got, say today, I have diagnosed a very interesting case of toxoplasmosis. What is the interesting about toxoplasmosis, you may wonder? Usually toxoplasmosis you get in whom? In
compromised patients.
Immunosuppressed. But this patient is fully immunocompetent. 45-year-old lady with fully immunocompetent, and she has got toxoplasmosis. So this is a very rare case. It should be reported, and you will go through the review of literature, how many cases are reported so far, how to manage all those things. So some interesting cases you will get. You can definitely gather all the data, make a case series out of them, or publish the one of the case reports, some of the case reports, or present them in some conferences. Lot of opportunities. See, our Nandini CV, you should see. Big lot of credentials to our credit. Any other questions, Aditya?
Oh, and one more thing that you can do, as Sir said, you can make case reports. One of the things that my senior suggested was, whenever there is an interesting or a rare case, you go to your professor and you say that, may I take over and may I write the case report? You put it in the format for publishing, and then they'll give you author status.
Okay. Thank you.
Then, if no other questions, any other members in the chat section, they can post the questions on YouTube also. If not any other questions, we'll conclude this. First, I want concluding remarks from our mentors. Anjali, briefly, what's your remarks?
So it was really good interacting with the juniors. Got a broader perspective about internship. Now I can't repeat it, but still, we got a really broader perspective. Well, it was really nice.
Thank you. Nandini?
For me, I think it was about making new friends. I really like talking to my juniors and finding out their perspective. So I do this constantly, even with juniors in my own college. So I think for me, it was all about meeting new people. It was really fun.
Excellent. Finally, it's never-ending topic. Okay, never-ending. How much we guide, how much we suggest. Ultimately, it's you. When you are in the field, nobody can only you can face it. Okay. Yes, these advices will definitely matter, and it will definitely help you. Okay, to face it better. Okay, now if you're well prepared, you can minimize the chance of mistakes or some unnecessary apprehensions, all those things. But ultimately, it's you, your mindset, how you deal with the situation. Everything matters. Having said that, See, we all have done the internship. Thousands have done. I'm again repeat the same sentence. You're not the first one who are doing the internship in any way. Thousands, lakhs of interns have passed out. Thousand lakhs yet to come. So just a part of the process, going through a journey. Okay, so always ups and downs will be there, just like ECG. If ECG is always up, means what is that? What it means? Is it normal? No. ECG wave, can it be down all the time? No. If it's flat, if it's smooth, flat, what it means?
Disaster.
Okay, so it should be up and down, up and down. Sometimes you'll be praised for your work. Sometimes you'll get humiliated, or you'll get some insults. Okay, if you're not done something properly, or sometimes you may have to work more. Sometimes you may have to you will get all the time to make merry. So all these are part of the process. Okay, don't have high expectation, or don't crib too much. Okay, have a serene mind. Yes, whatever. See, just like our mentors already mentioned, Anjali told it very nicely. Take it positively. Don't blame the circumstances. Don't blame the college where you are in. Don't blame the setup you are in. Don't blame the facilities you are having. No. Ultimately, what matters is, yes, should be thankful to everything. Should be grateful for whatever you have got. Because there are so many people out there who have got minimum nothing. You are at least got something. They have nothing. Okay. So when you feel elated, you should think that, oh, there are some people above me also. They are doing much better also. So that will keep you balanced. Okay. So don't blame. Always take anything and everything positively. Try to grab opportunities out of everything. Okay. Blessing in disguise, we tell, so try to grab opportunities out of every circumstance. And my humble request is, have presence of mind in everything. Don't do everything mechanically. Try to learn something from everything. Just like Nandini was telling, even while drawing the blood also, you can learn something. Even while that collecting the sample also, with that color coded also, you can learn something. While putting from everything, you can learn something if you're interested. So make the best use of these opportunities and get the maximum benefits out of these. Having said that, I had a really wonderful session today with interacting you all. It's never ending. We can keep on discussing. Next year, I'll call again you as mentors and to guide your juniors, definitely. My suggestion is, yes, definitely work well, work honestly, work sincerely, simultaneously prepare well for your entrance. If you work a little harder this year, 1, 2, 3 years maybe saved next. Okay, so but don't compromise your internship experience for the sake of just studying. Understood? Because nowadays, many questions are framed from your internship case scenarios only, whatever you seen in and out in internship. So never give excuses for internship for the sake of your studying or PG entrance examinations. Thank you so much once again. Anything from your side, Trell? Our interns, new interns, Aditya, want to say something?
So
Yes,
I think this was very helpful for us. Got to know a lot of new things, and looking at it from the other side, from a post MBBS side point of view. So yeah, it was a very good session.
Yes, sir.
Swati,
Sir, it's a nice.
Sir, yeah, it was a really good session. Got to know a lot of things, like how do you have to be prepared before going into internship. And yes, sir, I would like to thank everyone.
Hriday?
Sir, it's a nice opportunity to interact with such a humble seniors who have told everything about the internship and what to do, what not to do, and how to behave. I feel really confident to start my journey as an intern.
My one last suggestion would be, watch videos. YouTube, for anything and everything, there's YouTube videos are there. You're stuck somewhere, watch YouTube video on that also.
Even you can watch the case discussions.
Yes. If you don't know something,
it's really helpful.
When you don't know something, which initiative, which tube to, don't think that you don't know. Immediately Google it or watch YouTube. You'll get solutions to most of them. I'm not telling that depend on them only, but most of the solutions you get there. Okay, so because many times asking others will be difficult for you, but you can be self-dependent like that. Okay, or anything, tomorrow surgery is there, appendectomy. Who knows? Suddenly, professor may call intern, come here, put the incision. It should not happen like you got the chance, but you are not prepared. Watch a video of appendectomy before previous night and go. Then you will feel some you'll feel some interesting and confident. Then you can ask professor if he's in a good mood. Sir, can I try the incision, sir? Please, I have studied and come. Then he can never say no. Come, put the incision. Then when you put the incision, then okay, do the next step. That's how. Okay. But be open-minded. Again, having said, you don't stick yourself that I'm going to take up surgery, so I don't want to learn medicine. No, nothing of that sort. You don't know where is your destiny, where you're going to be. Open-minded. Try to learn from every branch, from every person. Okay, so at the end you can decide. After getting a rank, you can decide which branch you want to take up and all. Okay, otherwise
but we need basic knowledge of all subjects. In general, as a doctor, we should have basic knowledge of all subjects. And after internship, you will not get opportunity for that.
Correct. Even I'm telling you, now only you might have decided I want to be a medicine physician. I want to be a anesthetist and all. See, some skills like suturing. Even if you take up anatomy, you should know suturing. Even if you take up pathology, you should know suturing. So some skills are basic for every specialty. So you will miss out such skills. So that's very important. So we have other 2 videos also on orientation of internship, where we have discussed many other aspects of this. So you can go back and watch them also. So you get to listen to many seniors, their experiences, like Nandini and Anjali, who have openly, very genuinely expressed everything out there. Okay, so thank you so much for actively participating in this session and spending your valuable time with us. Thank you so much, everyone.
Thank you, sir.
Thank you, sir.